My name is James Yakamais, the Neglected Tropical Disease Coordinator for Turkana County. The neglected tropical diseases we currently handle in Turkana County is Kala-azar, as a Visceral Leishmaniasis. We still have cases of hydatid and trachoma. These are the main cases that we handle in this county.
We are conducting active case search for Kala-azar cases. Turkana County is one of the endemic counties for Kala-azar here in Kenya, and specifically most of the cases being reported at Lodwar County Referral Hospital.
We currently have around 115 cases that we are following up. We've been following it up since 2019 when we noted that we have quite a number. There before, we had an erratic data, we didn't really have a clear picture, but from 2019, we have had an average of 100 patients, or 90 to 80. But from last year, we noticed an increase in the number of Kala-azar cases in this county.
When the community heard that there is Kala-azar, they turned out in large numbers, and they came because of the possible signs and symptoms. And currently you understand that there are upsurge for cases in other counties, and it has been on the media. So people are a bit cautious. If they just feel a fever and then they see their stomach is a bit enlarged and they have lost weight, majority of them turned out.
Most of the patients affected here are children for between 5 to 15 years. These are pastoral boys who go herding, and most of them you would see when they reach in the bush, they get these moles or antils, they play around it, especially in the morning. So they get bit and they present with the symptoms.
Most of the community around, once they hear a child or somebody is feeling unwell, they actually do therapeutic marks, because we have actually observed a number of cases, especially for the boys. They have therapeutic marks, especially around the abdomen, where probably a child might have complained, is feeling a pain. So they do therapeutic marks. That therapeutic marks, again, it might create also channels for infection into the body.
From the community side, a lot of health education needs to be done so that we raise awareness in all the pastoral communities, and including reaching out to those who are in the cross-border.
When they see those signs and symptoms, they should quickly bring their children to their facilities and be informed that the disease can be treated if earlier detected, and the patients can fully recover and resume back to their normal life.